Welcome to Innovate Training. My name is Carol Peugeot, and I'm your instructor for this course. This course is called Understanding HIPAA for the Medical Office, and this lecture is called Introduction to HIPAA. Well, what we're going to cover today is first we're going to look at the purpose of the Health Insurance Portability and Accountability Act of 1996. We're going to try to look at the scope of the HIPAA law in the healthcare arena. What does it cover and what doesn't it cover? We're going to talk about what a security officer is and their importance with HIPAA compliance. And then we'll look at covered entities under the HIPAA law. What is a covered entity and how do we define it under the HIPAA law? Well, for the past decade, healthcare providers have been working hard to try to untangle this web of information regarding HIPAA. If you were to sit down and try to read this act page to page, you'd probably wind up with a massive headache and even more confused. What this course is designed to do is to break it down into bite-sized pieces and to fish out the important information that's needed by the healthcare professional and how we can take that information that's necessary for the healthcare professional and apply it towards our day-to-day actions between the healthcare provider and the patient, between the healthcare provider and the insurance carrier, and other entities that are involved in the processing of patients' information. The Health Insurance Portability and Accountability Act of 1996 passed both houses of Congress and became Public Law 104-191. It was then signed into law by President Clinton. HIPAA generated some new rules for health insurance plans as well as healthcare providers. There are 4 important issues that's addressed by HIPAA. The first one is protection of patients' privacy of health information. Second, standards for electronic transactions of health information and claims. Third, electronic security of health information. And then fourth, national identifiers for parties in healthcare transactions. Organizations and business challenges. So who is affected? Well, all healthcare providers, health insurance plans, and healthcare clearinghouses, and payers of medical insurance and other associated businesses. So what is a healthcare clearinghouse, as I mentioned earlier? Well, it's a business that submits healthcare claims on the behalf of the medical provider, bundles these claims, and then forwards them to various insurance carriers. A healthcare clearinghouse is actually a service that's provided for providers to help them submit claims electronically. So imagine working in an office and how medical information is passed from person to person in an office. Studies show that it takes 7 people to manage one piece of paper, for example. First, someone needs to file it or fill it with data. Someone needs to authenticate it, and what authenticate it means, either need to sign off on it or to verify it. Someone needs to distribute it. Someone then converts the data to meaningful information. In other words, they're doing some data entry, putting it into the information systems. Someone then has to file it. Someone then has to retrieve it. And then someone has to manage the final disposition of it. In other words, whether it's stored or whether it's going to be kept or archived. Because so many people are involved in the processing of patients' health information, there's so many gaps and areas that can actually become a weakness in the security of patients' information. It's actually very easy to violate patients' privacy, and most of the time, and I would say 99% of the time, it's done in ignorance or innocently as an incidental disclosure of patients' health information. And we're going to discuss those type of disclosures as we go through this course, especially when we get into the privacy rule in our next lecture. Well, according to HIPAA, there are 3 types of covered entity. And what a covered entity is, it means that this is a particular business or organization that has to follow HIPAA requirements. They're the ones that are usually involved in processing or storing patients' health information. Well, the first type of covered entity is a health plan. A health plan is such of entities such as Medicare, Medicaid, CHAMPA, TRICARE, HMOs, PPOs, or other types of private health plans. Another word for these would be a payer or a third-party payer or an insurer. Now, there are exceptions to this first type of covered entity. These are the insurance underwriters such as automobile, property, life, casualty, and workers' compensations. These are not considered health plans and do not come under this category. These types of carriers are not defined as a covered entity, yet they do have access to private health information in order to process claims. The second type of covered entity is a healthcare provider. This is a provider of medical or other types of healthcare services, or any person who furnishes, bills, or is paid for healthcare. This can be a physician, it could be a nursing service, it could be a pharmacy, or an equipment or medical supply provider. That's the second type of covered entity, a healthcare provider. The third type of covered entity is a clearinghouse or a healthcare clearinghouse. A clearinghouse is an entity that submits healthcare claims for a provider. Clearinghouses are used as a means to provide a safe way to transmit claims electronically, to scan claims for possible errors, to bundle claims that are sent to various insurance carriers, and to reduce the cost of obtaining contracts with individual carriers. These are an entity that provides a service for providers. Let's talk about a HIPAA officer. One person in each covered entity must be designated as a HIPAA officer. This is the person who coordinates and oversees compliance, or the go-to person for questions. Larger companies might need various people with different duties of the HIPAA officer. This is also known as the privacy officer, the HIPAA officer, or the privacy officer. And let's talk about the officer's duties. The HIPAA officer should have an understanding of HIPAA and how each department is affected by the ruling. The duties include, first of all, yearly training. They're responsible to provide training for all the employees in the covered entity. They are responsible for updating staff members on current HIPAA mandates. They are responsible to keep records of training for each employee and keep a record of who has access to protected health information. There should be other things to take into consideration when determining who should be this HIPAA officer. First of all, this person should be well versed in the HIPAA laws, and at least those concerning that particular covered entity. They should be a person who understands compliance and also who is not afraid to be able to go to their superiors and be able to explain where the entity is as far as compliance. We're going to talk a little bit more about this in further lectures. But also they should be a person where everybody else is comfortable enough with, where they can go to with their concerns regarding compliance. Well, in summary, we talked about HIPAA, and we talked about the fact that it was passed into law in 1996 and signed by President Clinton. We talked about the 7 titles of the Act, and then we talked about what covered entities are, that they are either an insurance carrier, a medical provider, or a healthcare clearinghouse. And then we also talked about what a clearinghouse is. We also talked about a HIPAA officer, and that each provider or each covered entity must appoint a HIPAA officer. And then we also finally talked about the officer's duties and the requirements and some suggestions as to who this person should be. So I hope you enjoyed this lecture. This has been Introduction to HIPAA. Next lecture, we're going to talk about the privacy rule. So I hope you join us, and we'll see you next time. Bye.